It's an interesting chart here which lines up healthcare costs, national debt, and greenhouse gas.
It's fine, I'm not on, so just walk.
Precept number 2, global warming and metabolic disease are manufactured plagues. And this is really evident in our industrial food system, which is responsible for up to 57% of global greenhouse gas emissions. Precept number 3, the ultimate solution to any environmental problem, metabolic disease, habitat destruction, involves addressing the problem at its roots. And certainly, some of those roots belong to sugarcane, which you can see in this chart lead in yield and tonnage. I'm going to try to debunk a few, 5 myths actually, about nutrition that are really perpetuating diet-related disease. Myth number 1, it's all about obesity and the energy imbalance. And this is really not true, since people don't generally die of obesity, and that is what is on the death certificate. People die of heart attack, stroke, non-alcoholic fatty liver disease, type 2 diabetes. That's where the money goes. Obesity is not the problem. Metabolic disease is the problem. I think I skipped this slide. Let me see if I can. We'll find it. So this is really evident in this exclusive view of obesity and metabolic dysfunction. So we look at 240 million adults in the US. 80% of those, 72 million, are obese. And 30% of that population has metabolic disease. That means 57 million people sick. But now look at the inclusive view of obesity and metabolic dysfunction. We look at the non-obese population, 168 million. 40% of the non-obese population have metabolic disease. We call those TOFI, and this is actually a medical term that's thin on the outside, fat on the inside. So yes, you can have metabolic disease, you can have type 2 diabetes, you can have non-alcoholic fatty liver disease, and not be obese. I'm one of the lucky people. I can tell when I have metabolic dysfunction. I look at a carbohydrate and I gain weight. So you can see there's 67 million obese, 67 million non-obese sick folks in the United States. That's more than the obese population. So if it were just about obesity, this wouldn't be true. And what does this look like typically is what's going on with our liver. Fatty liver disease. If you're not a drinker, that's non-alcoholic fatty liver disease, and if you're a drinker, that's cirrhosis of the liver. And these basically look exactly the same under a microscope because sugar and alcohol have basically the same effects. Body weight and calories are essentially dumb numbers, and we use those to really gauge our health and nutrition. Calorie counting is not enough. Body weight and BMI is not enough. Thin people and gene types are at risk. Glucose, blood sugar, is often a measure that's used when it's too late, when you already know you're pre-diabetic or diabetic. We need smart metrics, like what's inside, such as the nutritional content of food, its food values, macronutrient ratios, fiber. Waist circumference is important. Percentage of body fat is important. Liver fat, ALT, these are tests that can be done. Liver ultrasound, uric acid, fasting insulin, lipoprotein particle profile, triglyceride HDL ratio. You've probably never heard of these measures, but these are really what we need to know if we have metabolic disease. Diet-related disease is responsible for 75% of healthcare dollars. This is, again, spent on diabetes, hypertension, lipid abnormalities, cardiovascular disease, non-alcoholic fatty liver disease, polycystic ovarian disease, cancer, and dementia. Today, 25% of the global population has metabolic disease, and 347 million have diabetes. Diabetes is not a subset of obesity. Obesity is increasing worldwide by 1% per year. Diabetes is increasing worldwide by 4% per year. Again, it's not about obesity, it's about metabolic dysfunction, of which obesity is a result, not a cause. We see this with the incidence of children with diabetes. When I started my career, 1979, I started the first certified farmers market in California. The next job I had was working in a senior health center. And back then we called type 2 diabetes geriatric diabetes or senior citizens diabetes. There was no type 2 diabetes in the child population. And in just several decades, we now have 20,000 children in the US with type 2 diabetes. When we do an econometric analysis of diet and diabetes globally, what we've seen is that the only changes in sugar availability correlated with changes in diabetes prevalence. Every 150 calories increased diabetes prevalence by 0.1%, but if those 150 calories were a can of soda, diabetes prevalence increased 11-fold. Before I came in, I was interviewed by the television cameraman. At the end, he said, "This will kill you, but I had a can of Coca-Cola with my breakfast." And I said, "Brother, it's not going to kill me, it's killing you." So these data, and this is a global study, suggest that 25% of diabetes worldwide is explained by sugar. And I'm talking about added sugar. We look at some more comparisons, comparing health spending per capita. And the top line there is the USA. You can see that we're really breaking away from the pack. And then on the right, you see total expenditures on health as a percent of the GDP. Again, breaking away from the pack. We're the top line. Where does all this money go? Even though most of the disease in America is diet related, we aren't using it to prevent disease. We're spending 97% of it on treating disease. 3% is going to prevention. Even though 75% of our healthcare costs are related to preventable conditions, mostly diet-driven. So, how many have heard this? A calorie is a calorie. All right, well maybe you've heard this. This is stated by Coca-Cola Company. Beating obesity will take action by all of us based on one simple common sense fact. All calories count, no matter where they come from, including Coca-Cola and everything else with calories. So this is how you determine what a calorie is. You put food basically into an oven. It's called a bomb calorimeter. And there are some scientific instruments that measure the thermodynamic exchange. The problem with this is your body's not an oven. It's a living biochemical organism. And we need to look at other things such as nutrient density, biotic value, fiber, etc. What the science says is some calories cause disease more than others, such as sugar and trans fats. Different calories are metabolized differently, whole grain versus processed grains, and that biochemistry, not just thermodynamics, should be used to evaluate food values. You are what you metabolize, not what you eat. Processed food. If it has a label, it's a warning label. Processed food is a story of too little and too much. Too little fiber, too little omega-3 fatty acids, such as that found in wild fish, micronutrients, too much trans fats, too much branched-chain amino acids, omega-6 fatty acids, which cause inflammation, alcohol, and sugar, of course. Sugar consumption has increased dramatically in the last 30 years. And, of course, sugar production soared. We look at the world supply and demand of sugar increases every year. 74% of US foods on the shelf, anything you go in the supermarket, 74% has added sugar in it. Sugar consumption rises along with obesity, and this is a long view from the 1700s, but look what happens in the last 30 years. You see this big jump, and this is really the story of the explosion of processed foods. Again, we line up consumption of sugar-sweetened beverages and prevalence of obesity. On the left-hand side, you see daily caloric consumption from sugar-sweetened beverages in the US. And on the right, you see prevalence of obesity amongst US adults. Correlation is really obvious. Then we look at sugar consumption in cardiovascular disease. Those who consume 25% of their calories from added sugar were 2.7 times more likely to die from cardiovascular disease than those who consume less than 10%. So the public image of sugar is shifting. This is actually from England. But sugar has become the leading marker for processed food. As I mentioned, there's 600,000 food items in the US food supply, and 74% have added sugar. And once upon a time, sugar was our pal, now not so much. Problem is that it's hidden in so much of our food supply, and this is a breakdown of where sugar is being hidden. 47% in sugary beverages. So, you know, one good rule to follow is simply don't drink your calories. That should be rule number one. Number two, obviously, the processed carbohydrates, snacks, and sweets, and 22% other. You know, when you walk to the supermarket now, you see sugar on meat, on nuts, in salad dressings, and just all kinds of things where you wouldn't imagine seeing sugar before. So what is the recommended limit for added sugar? American Heart Association and the World Health Organization agree no more than 10% of total calories should come from added sugar. For men, that looks like 9 teaspoons of sugar a day, and for women, that's 6 teaspoons a day, and for children, it's 3 teaspoons a day. But you get 9 1/3 teaspoons of sugar in a can of Coke. Dental caries starts at 5%. At 10 to 25%, this is actually, 25% is the upper limit recommended by the Institute of Medicine. Can you imagine? 25% of your total calories coming from added sugar. That puts you at risk of heart attack at 30% or higher. 1 can of soda a day puts you at 29% risk of type 2 diabetes. Myth number 3, you are what you eat. Fat makes you fat, right? Unfortunately, as far as science goes, the fat hypothesis is pretty much dead. There's strong evidence that total fat consumption has little impact on obesity. And you can just look back the last few decades at the low-fat food marketing scam, which has been selling us basically low-quality carbohydrates and processed food with added sugar in it. Pretty much anytime somebody puts added sugar, low sugar on a label, they're really adding sugar, because when you take fat out of the product, what do you get? It tastes like cardboard. So you have to put sugar and salt in there to make it taste palatable. We need to know that healthy fats are bioactive and essential to our health, and the human organism can survive without carbohydrates, but not without protein and fat. Turns out fat isn't making us fat. Simple carbs like bread and corn may not look like sugar on your plate, but in your body they convert to sugar almost instantly, and that sugar overload gets stored as fat. And this is bad news, because I used to be one of those bagel lovers, but a bagel is no different than a bag of Skittles to your body, according to Harvard epidemiologist and distinguished nutrition scientist, Dr. Mozaffarian. Processed carbohydrates and sugar are making you fat. Again, low fat is code for sugar added. It's a processed food marketing scam. The best available research suggests poor quality carbs affect the size of our waistbands at least as much as desserts. Poor quality, low nutrient and fiber carbohydrates are a clear risk for weight gain, metabolic dysfunction, and diabetes. The poorest quality carbohydrate is added sugar. It has no nutrient value, no fiber, and is toxic in sufficient quantities. Processed carbohydrates convert readily to sugar, and in excess quantities get stored as fat. Again, you are what you metabolize, not what you eat. Myth number 4, it's all about personal responsibility. And the food industry is constantly doing this and just saying, look, the problem is you eat too much and you don't exercise enough. It's a matter of personal responsibility. But what we know, when you see the charts that I showed you, is that this is an exposure. This isn't a genetic breakout. This is really an exposure, and this is altered biochemistry. And we know that this is a pandemic that is entirely preventable. We saw the rise of type 2 diabetes in the last 30 years in the child population, and globally it's just exploding. So who is responsible? Processed food industry just says simply eat less and exercise more. Consumers are to blame. But unfortunately, science doesn't support this myth. We know that to be responsible, we need knowledge and access to real, affordable food. So personal responsibility requires knowledge. That's not what the food industry is selling. This is what they're selling. 56 different names for added sugar, and honestly, I could have put 80 on this slide, I just didn't have enough room. And some of these sound good. I go to Whole Foods, I try to go to health food stores, but they don't get it either. You see organic evaporated cane juice, agave nectar, grape sugar. These sound kind of nice, don't they? Unfortunately, they're all pretty much the same chemical composition as table sugar. There may be slight variances in the ratio of glucose and fructose, but essentially they're pretty much 50% glucose, 50% fructose. And fructose being the bad boy, you saw the sugar cube on the motorcycle there. 100% of fructose is processed in the liver. That's the problem. Glucose, not so bad, because every living thing on earth needs glucose, and it's something that can be processed throughout the body, but fructose goes to the liver, and the liver gets overloaded, and it turns it into unhealthy fat. So wouldn't it be great if we could look on the food labels and just know that there was added sugar in there? Well, we all know about the sugar lobby. Well, they've been successful in ensuring that the only food item that isn't on the label is added sugar. There's no dietary reference intake for sugar, unlike other food products. And ironically, the rationale they give is, why would you need a DRI for something that was not a nutrient? So if it's not a nutrient, why is it in our food? It's not food. And the other excuse they give is, well, if we told you how much added sugar we put in there, we'd be giving away the recipe for our secret sauce. It's a proprietary ratio. Really. So telling us that this is a problem of personal responsibility would be just like telling us we have to solve the problem of lead poisoning and foodborne illnesses and AIDS and teen pregnancy and guns simply by telling people it's a personal problem. We do need societal intervention. And we do need a continuum. I'm not saying that we as individuals shouldn't be responsible for our health. I'm saying that it's a continuum of responsibility, and it's not okay to just stand on the sidelines and say it's all our fault. So myth number 5. Industry and government can be trusted to regulate and fix the food system and protect our health. Okay, who in this room actually believes this myth? Raise your hand. All right, I get it, but there's some cognitive dissonance here. Why do we allow the status quo to continue?